March is Endometriosis Awareness Month. So it's Dawn, your natural hormone balancing specialist, here to give you a little bit of an explanation and some hope when it comes to endometriosis. Because endometriosis affects 176 million women. And it's usually from age 15 to 49. And the reason it curtails at that point is because hormone levels go down and everything kind of dries up normally if things aren't done. And therefore, that the tissue is going to dry up as well. So let's talk a little about endometriosis. What is it? What's the problem? Why is it plaguing so many women and we can't find an answer? Will it be balanced? We do have an answer. So what is it? It's tissue that should be growing inside the uterus, right, to make a soft spot for the baby that grows every month, right? You have that tissue endometrial lining of the endometrium builds up. Whether you're pregnant, okay, not pregnant, then you shed it and you have a period. Well, when something goes awry, and it's basically hormonal imbalance, this is what we specialize in, something goes awry that this tissue starts to build anywhere, on the ovaries, on the outside of the uterus, obviously, on the bladder, even restricted in the bowel area, all that area. And then what happens is when the young woman starts to have her cycle, she will bleed a lot because all this tissue is bleeding. She'll also be in pain. So it could cause painful periods, heavy periods, pain during sex, pain going, having a bowel movement. I mean, it's just a really terrible thing. But if left unchecked long term, let's say somebody's like, I'll just live with it and take Motrin. If left unchecked long term, it can actually cause infertility. So the way it usually gets diagnosed is there's a variety of symptoms, like things I just said. And then a woman will go to the doctor, and then they'll usually do a pelvic exam. Very important to go to OBGYN to get a pelvic exam. And then they'll sometimes do an ultrasound. And if they have to go further, they'll go in with different instruments, and then they'll test and see like what's really going on and see where the tissue is and how bad it is. But that's kind of basically the scope of it. What are women told to do? Pretty much go on the birth control pill, take pain medicine. If it gets bad enough, then we'll do surgery and then we'll remove the tissue. But then how do we know the tissue is going to come back? We don't. So that doesn't seem like the best solution. So I think back to when we first opened one of our centers in Texas, and there was a girl that came in. She was like 29, 30, somewhere in there, younger. And she basically had 9 operations for endometriosis. And she had a really cool doctor who was trying to work with her. He was doing his best. She did our program. And within 2 months, the endometriosis just shriveled up and dried and went away. Now, there has to be something, an ongoing imbalance to keep that tissue keep going, and thicker, spreading. And we don't want that. So let's look at what the underlying hormonal imbalance is, which is pretty simple. And it's connected to PMS, menopausal symptoms, your weight, all these other things, your sleep, your mood. So if we can fix this imbalance, it's going to help the poor women that are dealing with the endometriosis, but it's going to also help the variety of other women that have PMS and menopausal symptoms. So let's get into it. Okay, as you see here on this board, most women are under stress, and I don't think anybody's going to deny that. Stress is out there. It's not just our finances, our family, our jobs. It's artificial light. It is getting stress from our computers and our phones, the EMF stress that comes off that. Stress in the sense of our foods and water, there's toxins in them. That's stressful to the body. So there's all sorts of stress. And when stress goes up, it causes an increase in cortisol. And cortisol is the stress hormone that's needed to buffer us from stress. So when cortisol is high too long, it actually can't be made quick enough by the body. So the body steals progesterone, a very vital hormone that no one talks about, and lowers the progesterone. And as we move over here, it leaves even young girls in balance. So you look at this, it says premenopause. The estrogen might be normal, but the progesterone is low, and that's out of balance. Then as women get older, estrogen falls just a little bit, but it's progesterone that falls the most, and that's an even bigger imbalance. That's why PMS can be bad, but when you get to menopause and those types of symptoms, they're even worse. Now, why is it important? Because estrogen and progesterone are 2 different things. Progesterone is your best friend. It's a fat burner, it's a diuretic, and it helps with mood, it helps with sleep, and it helps prevent female-related cancers. Estrogen does the opposite of all of those things and causes you to have a higher appetite, causes you to hold on to fat and fluid, excites you so you can't sleep, you have anxiety, and it also overstimulates tissue, which is going to be connected to overstimulating tissue for endometriosis or even fibroids, cancers, things like that. So basically, that little imbalance between estrogen and progesterone causes all the problems women deal with when it comes to with any type of thing, when it comes to PMS, which is the whole younger group of women, and then perimenopause, which is very real too, and then menopause symptoms. And it's just all a sliding scale. And if we can get rid of that imbalance between estrogen and progesterone, which is what BeBalanced specializes in, there doesn't have to be a buildup of endometriosis tissue. So anything you can do that's actually going to be lowering your cortisol level is going to be excellent for endometriosis, because by lowering that cortisol level, it allows the progesterone level to come up and balance with estrogen. And estrogen in excess and not being opposed or balanced out by progesterone is what's acting on the endometrial tissue. It's that simple. Trust me. At BeBalanced, I've worked with women. I've been in this field for 30 years, but working with hormones for over 22, 23. And we've seen great stories of women that are like, wow, this is really reversed for me. And we don't want to make huge claims, but that's kind of what it comes down to. So a couple of things you can do as far as yoga is great. Intense exercise is actually going to maybe increase cortisol. So if you're running, that's not going to be the exercise for you when you have endometriosis. That'll actually raise cortisol, throw off blood sugar balance, throw off the sex hormones, and cause the endometriosis to be worse your next cycle. So you want to do things like yoga, Pilates, walking, everything, just bring it down and relax. You also want to consider meditation and taking 20 minutes a day where you can just relax and focus and not have to be thinking about all the things that are going on in the world. Think about your goals, think about things that you want to do, or just let your mind be free. And listening to relaxing music, usually with headphones right in, is excellent. I always tell people to listen to their heartbeat. Buy a cheap stethoscope and listen to your heartbeat. And that's beautiful. That's the first sound you ever heard is your mother's heartbeat. And that kind of relaxes you and lulls you. So there's a couple of tips. When it comes to caffeine, that's overstimulatory. So is alcohol. You're going to want to go with green tea, which has the L-theanine, which just kind of can relax you. You're going to want to think about supplements such as omegas. We have our essential omegas at BeBalanced. All our supplements are third-party tested. Omegas have been proven excellent for endometriosis in general. To stabilize blood sugar, they help the heart, they help the brain. There's so many other things, but they're also going to be good for endometriosis as well. Magnesium is good for 350 processes in the body. So our magnesium is a full spectrum that's going to go in and be absorbed. That's always going to be good. And anything like that is going to be good for your stress levels. It's going to help with endometriosis. But the biggest thing you can do for your endometriosis is come in to BeBalanced, do a free consultation, and we will give you more information on our natural hormone balancing cream. So what do we talk about? We talked about we need to raise progesterone. Our natural hormone balancing creams is one pump. It goes in directly. We have a chemist that works specifically for us. We have our own lab. It goes directly into the bloodstream. Any excess is urinated out. And this is USP, United States Pharmacopoeia, standardized progesterone, 20 milligrams. That's the amount your body physiologically produces. And we have different protocols based on your symptoms. Too much isn't going to hurt you. You urinate it out. There's no overdosing. Not enough. You're just not going to get results. So think of it as vitamin B and C. If you had scurvy, right, which nobody has that anymore, but lack of vitamin C, you came over on, let's say, with the Pilgrims, we wouldn't say, well, let's figure out the dosage of ascorbic acid or vitamin C. No, we would just say, let's give that person some kiwi, some oranges, and then the body will make what it needs. The same with our natural hormone balancing cream. We give you a certain amount, but any excess will be urinated out like vitamin B and C. And if you don't take enough, you're just not going to get the results. That's why we have protocols. So you will notice a change by your very next cycle, whether it comes to headaches, whether it comes to, missed periods, that can start to get regulated. When it comes to cramps, when it comes to cravings, the very next cycle, as long as you start using this cream 2 weeks before you actually have your bleed or before you actually have your menstrual cycle. But to BeBalanced, we go one step further. We have an adrenal cream. Let's support the adrenal gland. What is the reason we're having the imbalance to begin with? Because of stress, because of draining progesterone levels. Our adrenal cream goes in there and gives the body what it needs to make cortisol, so it doesn't have to steal progesterone. And then the progesterone levels can kind of build up. And when I say build up, get back to optimal levels is what I mean. So Even things in here like maca. We're so into these adaptogen herbs like ginseng, ashwagandha. They're going to be great for endometriosis. They're going to stabilize that stress response, but we do it in a cream form. So it goes right in, bypasses the digestive system. And this stress cream is going to help our progesterone cream work better. So we call this Soothe Stress and we call this Pro Plus. So the biggest thing you can do for your endometriosis is some of these tips I'm giving you here, but finding a BeBalanced center. Go to BeBalancedCenters.com. We do virtual appointments. You just give a call, say, this is what I'm dealing with. We'll give you a symptom sheet. We'll look at everything. We'll talk about some of the things I talked about in this video and expand on them a little bit more and let you get started. If you need to lose weight, we have a full weight loss program that includes the same ingredients in these creams during that weight loss program. And then it stabilizes your hormones while you lose weight, 15 to 20 pounds in a month. And then afterwards, you can go on the natural hormone balancing creams. But we work with women of any age, from puberty to postmenopause, and we're here to take the guesswork out of weight loss, wellness, and hormone balancing, and endometriosis is a part of that. So come see us at BeBalancedCenters.com, and I think you'll find that endometriosis is a thing of the past.